says there is a 5 to 7% chance I will have permanent nerve damage from extracting my lower wisdom teeth. Should I remove them? He said I am at high risk since I am a bit older. I know I shouldn't have waited so long to remove my wisdom teeth. They don't really bother me too much, but the bottom one is sideways, which looks menacing. He said the risk would be that it could be infected sometime in the future and end up having to come out anyway. He wouldn't lean one way or another in terms of whether I should remove it. He just wanted to give me the facts and have me make my own decision. I am torn. I don't want to risk permanent damage, but at the same time, I am paranoid about my teeth. Any help?
A great question. So the question is, as the Reddit person asked, if you remove your wisdom teeth, there is a chance of having a nerve damage. If you don't remove your wisdom teeth, then you're going to end up causing other problems to your other teeth. So should you remove your wisdom teeth or not? Again, going back to the patient that we talked about who came to see me today. So the second molar, which is the back tooth right here, it's sitting right here, like standing like this, and the wisdom tooth is sitting like here. So he's only 18 years old. 18 or 20, I think. 20. He's in college. 20 or 21, I think. Yeah, 21. So he's in college. So he needs to have his wisdom teeth removed. The wisdom tooth is so close to the nerve that goes down the bottom of the bottom jaw here. So I exactly discussed the same thing with him. So he needs to have the wisdom tooth removed because he has we talked about the cavity on the tooth in the front. So he has a cavity in the tooth on the front, and he has a big cavity on the wisdom tooth in the back here. So when he went to the dentist today, the dentist told him, oh, you got some pain starting on the wisdom tooth because you got a big cavity. You got to go see Dr. Vadivel. So he came to see me, and I've been treating his family, his mom and his mom's sister for a long time, and that's how I ended up seeing him. So I talked to him about the problems. So now, hey, you're really in a catch-22 situation because your wisdom tooth is so close to the nerve here. If you remove it, there is a small percentage or a small chance that you may end up having some nerve damage. But if you don't remove it, then you're going to end up losing the tooth in the front. What would you like to do? But let me ask you this. Let's say if you're afraid of nerve damage, and the chances are less than 5%, or maybe in your case, it's less than 1% because you're so young. So if you don't remove it, then the cavity is going to get bigger. And not only the cavity is going to get bigger on the wisdom tooth, there is no way you can stop that. And the cavity is going to get bigger on the tooth in the front also. So if you're afraid of removing that now, or if you're afraid of taking that risk now, you're going to be forced to take that tooth out when the cavity gets bigger, correct?
Right, yeah.
So at that time, it may be a couple of years from now, your risk is not going to change much. But let's say you're going to leave that tooth for another 10 to 15 years. Now you're almost 35 or 35 or 37. Now you're increasing your chances of risk really high. So normally the recommended age with not much of a risk to remove the wisdom teeth is about age 35 or less. Once you pass that age 35, you're increasing your chances of getting any kind of nerve injury. And not only increasing your chances of nerve injury, if the nerve injury has to happen, then as you know, as we get older, we are going to take longer for that to heal. So the chances of your nerve injury, one nerve to repair itself, or the nerve injury to get better, it becomes less also. So again, going back to what this person is asking, are you increasing your chances by waiting longer? Yes, sir. You are going to increase your chances by waiting longer. Why is the oral surgeon telling you to make the decision yourself, instead of telling you what you should do? Because as clinicians, we are supposed to give you all the information that you need, and we are going to explain all the risks to you. That way you can make an informed decision. What I tell my patients is, yes, these are the risks, but if it is my own tooth. Just like I told the guy from today, hey, if you're my son, if you're my brother, and I'm going to tell you to get the wisdom tooth removed because I don't want this to happen 5 years from now. You are you're already in a catch 22 situation, but you don't want to be in a stuck situation. Now you're older, but you don't have a choice other than removing the wisdom tooth, but you are at a higher risk because you waited longer. So when you're young, get them taken care. And even before these wisdom teeth cause problems, and I recommend any teenagers, if you have a teenage kid, when they are around age 15 or 17, before the wisdom teeth start to come through. So make sure that you're going to take them to your dentist, ask your dentist whether these wisdom teeth need to be removed, and before they even become a problem, just get them taken out. That way you don't have to worry about this person, whether you're going to have any type of nerve damage, whether you be really removing them or not, whether you're going to have problems by removing them. So no questions asked. When you're young and healthy and before they cause a problem, you get them removed and be done with it. So that way you can just carry on with your life. Don't even have to worry about wisdom teeth causing any type of pain, swelling, problems, crowding, nothing like that whatsoever.